Hi, I'm Gwen Howard. I'm coming from Medical Aesthetics in Evergreen, Colorado. And today we're going to be talking about an advanced medical aesthetic procedure using a Class 2 machine called Vivace. It is a radiofrequency microneedling light therapy, so a 3-in-1 treatment for our clients to address fine lining, glycation, pore size, acne scarring. Does help with acne as well. Using red or blue light, we can help treat clients to address the needs that they have. Using the treatment, we do 3 passes. We can do more for a more aggressive treatment. What we love about this treatment is it penetrates the skin at different depths. We can go anywhere from a 3.5 coming up through the skin to a 0.5 for more tightening and lightening and more of a radiant glow for skin. There's no downtime with this really. It's a little to no downtime. So usually when doing this treatment, people can leave looking a little red, but by the next day, really can't tell they had anything done. But through the weeks, they do see more gradual progression as far as what their skin looks like and getting the results that they wanted to achieve. So, starting the treatment, I've set the settings for our client. We're going to be at a level 5, that is our wattage. So we're going to be at a 35 wattage. We're at a 2.5 millimeter depth, and we're going to be 500 milliseconds on the skin. If you have a client who is older, who has more glycation, more heavier lining, larger pore size, you maybe want to bump up your level so you have more radiofrequency in the skin. Plus you also may want to be on the skin longer, so make sure you adjust your settings for that. So starting the treatment, we did numb our client for 30 minutes prior to treatment since we are going to be going at a pretty deep depth. Our first pass, we're going to be at a 2.5. So I'm placing the needle on our client and I do 1 pass. How did that feel? Feel fine? Mm-hmm. As long as the client is comfortable, we're going to proceed with the level setting and the depth that we're at. So as the needles are penetrating the skin, they're actually delivering the radio frequency. And what is so great about this treatment and why it's so advanced and it's taking off more and more in the market, you're seeing more of this, seeing more clients wanting a service like this as opposed to doing any kind of Fraxel or CO2, is because this doesn't cause the downtime. You don't have the peeling, your skin doesn't look beat up, but you have the great procedures as the skin is healing. We space this procedure about 4 to 6 weeks apart. And right now we have a red light therapy going. If there is a client who does have acne, cystic acne, we can go over with blue light therapy to kill any bacteria and help on a more deeper level to change the skin. It really, truly, that is one of the bonuses I have with a lot of clients, is they are finding they're getting less and less breakout. The way I always describe microneedling, why it's so important and why I prefer it as opposed to doing laser sometimes even on my higher Fitzpatrick or darker skin tones, is because microneedling really helps to realign and change the skin without creating heat in the skin. So one analogy I always give my clients, we do have a lot of people who work out up here, so I always tell them, you know, you go to the gym and you're trying to build your muscles. When building your muscles, you're actually breaking those muscle fibers so they can thicken and strengthen and your muscles get bigger. So by needling at the depth for your elastin and collagen fibers, you're breaking those so that way they can strengthen themselves, realign, and thicken back up so you can help with lining and scarring and the stimulation of your collagen and elastin. Now clearly, one and done is not a good model to do. You want to make sure that you're doing at least 3 treatments with this when we do maintenance throughout the year depending on our client's damage, because you're retraining the skin, you're helping it rethink. So by realigning the collagen and elastin fibers, you're helping to strengthen the skin, smooth and soften lining, tighten the pores. This does help with redness and rosacea. Mildly helps with hyperpigmentation. Usually I find that IPL is best for hyperpigmentation to really attack that damage. How does this feel so far? Okay. So as that needle is penetrating the skin, again, we're delivering that radio frequency and some red light therapy. The red light therapy is going to help to stimulate the collagen as well. Something else you can notice with this procedure, when doing regular microneedling, a lot of times people will get pinpoint bleeding. This is not causing pinpoint bleeding. It is a clean in and out because of the radio frequency and the insulated needle here. You're cauterizing. You're not causing any of that pinpoint bleeding. So you can see a little bit of my track mark as I'm going. And that's all going to fade and that inflammation is going to come down. Some of the side effects some people can get, some of my more sensitive clients with a first treatment, is because of that histamine response. They can get some hive reaction, usually subsides within probably an hour or so. But I do always let my clients know, obviously, all of the side effects. Okay, now we're going to move to the other side. Same thing. When working with the needle, we're stamping the skin, so we want to make sure that we're perpendicular. You don't want to come in at an angle on the skin. You can cause pinpoint bleeding, but that's because your needle's going in and out the wrong way. If I had a client who was older, on the second or third pass, what I might do is concentrate more on the neck bands, any heavier glycation, and I would raise it to a stronger megahertz. So right now we're at a 2 megahertz, which is at a comfortable level. 1 megahertz, and I know feedback from my clients has been they feel more of the heat. And that's because that megahertz is stronger. It's going to deliver more heat throughout that layer to do more for the collagen. So we've got the microneedling working on the collagen and elastin fibers, helping to realign, strengthen, stimulate cell growth, radio frequency stimulating collagen and elastin, helping cells as well, helping to tighten, and then the red light therapies helping with inflammation and collagen again. One placement when putting on the numbing cream on your client, and a lot of people forget to do this, don't forget to move or travel back behind the ear a little bit. So that way you can get this spot. A lot of times women get the crepiness around their ears, or they have some crepiness behind the ear as well. You want to make sure you're getting that area as well for anti-aging purposes. Still doing okay? And what I mean is right in this area here. You want to stretch and hold the skin, especially if they're crepey in that area, because you want to get between those lines. You don't want to just be sitting on what you're seeing on the surface. So my client here is fairly young, so she doesn't need me to tighten and pull a lot. But if I had a client who was older, again, I would make sure if I have lining on this area here, I'm stretching and holding the skin between both fingers. So I'm getting a nice stretch and a good penetration for my needles and the frequency and the light therapy. Again, realistic expectations is key during your consultation, especially when doing any kind of anti-aging service. You want to make sure that they're aware that this isn't an end-all be-all. Home maintenance is really key to any service. I always tell my clients what I'm doing here is great. It's like an aggressive workout. But obviously what they're going to do at home is going to be a big payoff and maintain their results. One question I get a lot from clients too is this forever? Well, It's definitely a forever thing as far as retraining your skin, but you can't stop the aging process. It's still going to happen. Are you ever going to stop smiling or moving your face? So that's why Botox and fillers still can be key into your anti-aging surface, because this isn't going to stop the facial muscles from moving. So Botox is usually something we have clients do in conjunction with this service as well. What's nice for this client, so she does have the redness in her skin and also some medium-sized pore size around the nose and the cheek area as well. So this will help to tighten it up by strengthening and stimulating that collagen. So now we're going to change the setting because the forehead obviously is more bony. We are at a 2.5 millimeter depth. Coming to the forehead, if I was at that depth, it would push the needle off too much. You're not getting much penetration for that. So we're going to come down to a 1. If you have someone who has a little bit more skin on this area, you can feel it and everything. 1.2 is usually sufficient. What I like about this needle as well is that on passes I can go on this orbital bone area, periorbital area as well, to really get any crow's feet, lift and firm and tone the skin. When doing that though, you obviously want to make sure you're lifting. Another contraindication with doing any kind of microneedling and even with radio frequency, make sure you're finding out if your clients have permanent makeup is one. Metal implants, obviously you cannot or should not go over any area that does. Cold sores, those kind of things. And it's not that you can't with cold sores, you just want to make sure that they're taking their medication, so that way you're not stimulating anything with the radio frequency. And you can see the needles pushing off a little bit, but not too much. If I was doing a stronger depth, it would come up too high on her. So now we're going to go over the nose. I like to squish it up right through the middle so I can get it a little bit more, and right here. Okay, now I'm going to get on this orbital bone area. And stretch the skin down for below. Never want to go with a 2.5 around the eye area either. Very thin skin, you want to be cautious. And a good stretch is important. If some of your clients have the rhytids around the mouth, you can certainly do more passes. Very gently though, again, don't go with too strong of a depth, but go over those lines second and third pass as well. So we've done one pass. You can see the pattern. She has a little bit more redness, and you can see it more on the neck. The skin is different in this area. It's a little thinner, so people can see it a little bit more on that. I'm going to move to the second pass. So we're actually going to be coming up in the skin. So we're at a 2.5. We're going to switch to a 1.5 millimeter right now. Now, on the second or third pass, what I might do, and I said this before, if there is a client who has glycation, acne scarring, larger pores, trouble areas, I'm going to go with a stronger megahertz, and I'm going to go possibly still with a 2.5. Acne scarring, we can treat that area with a little blue light, and then we can do the 1 megahertz. Glycation, which we see a lot around the mouth area, we're going to use the red light for the collagen, and we're going to treat that maybe a little more depth as well, maybe 2, 2.5, depending upon the thinness of the skin. If it's thick like a leather glove because of the glycation, you can go a little stronger. If it's thin and the skin is thin and they're very petite, I would probably go with more of a 1, 1.5. So she really doesn't, again, have too many issues. All I'm seeing is maybe a little bit more of a larger pore size, still just more medium around the nose and the cheek area. So first what I'm going to do is I'm going to just do her second pass, and then I'm going to come over and do a little blue light and a stronger megahertz on that spot specifically. But other than that, she's in good shape. She takes really good care of her skin, we can tell. On the second pass as well, I may do a different pattern, just so I make sure I'm covering all areas. Again, though, you want to make sure you're holding your needle perpendicular. You do not want to go in at an angle. And listen, I can always hear to make sure when I'm lifting off. We're at a 500 megasecond or millisecond, sorry. That is time on skin. The shorter the time on the skin, it's going to go a lot faster. But for more anti-aging purposes, you want a little longer anyway. Okay, so we're on our final pass, which is going to be more about tightening. So we're more at that surface epidermal dermal layer. We're at a 0.6 millimeter. And how does that feel? Yeah, usually this pass people don't really feel much. And as you can see, as we were talking before, she does have the redness. That's her histamine response. That's what we want. So we don't want her using any kind of antihistamines for the next 48 hours. No ibuprofen, because we want that response. We want that Langerhans cell to stimulate, to go in there and repair, realign, and strengthen the skin. And during one of the passes, I did go over, she did say she had some breakout that she usually would have occurrence around the mouth area. So we did a little blue light around there as well. So that way we can treat that area and hopefully help to curb all her breakouts in the future. The next step after her third pass, so I'm going to massage a pure hyaluronic into the skin. Post-treatment for microneedling, you need to remember that hyaluronic is okay. You don't want to use anything too heavy. Nothing with a large molecule. You can actually cause a problem. These channels are all open. And if you use your heavy creams, or the client goes home and uses a heavy cream, they can cause granulomas and scarring, clogging. We don't want that. So we will be giving her the pure hyaluronic to take home. What I find, even with my regular microneedling procedures without the radio frequency, is I have them massage their hyaluronic in every 20 to 30 minutes post-procedure for at least 2 to 4 hours. What I find with that is it helps bring the inflammation down and speed up healing. Post-procedure, about 48 hours, they can go back to using their cleanser and their cream. No retinols, no exfoliants, no alpha hydroxys, beta hydroxys for at least 7 to 10 days. You don't want to cause any aggressiveness on the skin. It's turning over. It's a little fragile right now, so you want to make sure you're cautious with it. Like I said before, we usually do every 4 to 6 weeks. The first one is usually a baseline. It gives me an idea what they can tolerate, how their skin responds. So when I have them come in for their 4-week appointment, I'll be able to take a look at that and determine, okay, maybe I need to go with a little bit more depth or a little more megahertz on some areas that have more damage. But then between the second and third appointment, I like to space that out about 6 weeks. I want a full turnover for the skin, and I want the skin to heal so I know what I'm chasing after. Don't go in too soon because you don't know how much more the collagen is turning over or producing. You want to give that time so that way you're just not chasing something that is maybe not finally healed. So we're going to go around the orbital bone again for this tightening effect. Usually a good thing too, if you have a pure hyaluronic or another hyaluronic that doesn't have any buffer ingredients that aren't compatible with doing this procedure. Included in the cost of your package, because you want to send them home with one. You want to make sure that they're using the right product. So again, they're not causing granulomas and they're not causing any post-inflammatory pigmentation or any problems. So make sure they're taking that home, but make sure that they know that post-procedure, that if they use that all up because they love it so much, that they're going to have to buy an additional one later on. So we're all finished with her tightening. I'm just going to place this back on the cradle here. And I'm going to massage in a pure hyaluronic. This is, we actually have this made by a pharmacy, and all it is absolutely pure hyaluronic. Then we're going to be placing a mask. This mask doesn't have anything in it. Again, we have this specially made. We really like it. It's a cryo freeze mask. Brings down the temperature of the skin. It soothes it as well. So that way, usually we leave this on for 10 minutes post-treatment. They really have less redness in their skin as well when they leave. Remind your clients you're going to give them a post-care sheet, but post-treatment, nothing on their skin. And this is where it can get a little tricky, because you really don't want to be putting sunscreen on their skin post. I know that's a big thing in our industry. You need to make sure your client leaves with some sunscreen on. But you have to remember these channels are open. Sunscreens tend to be heavy. They can clog the skin. They can cause granulomas. You don't want that on the skin. They need to be completely clean all throughout their day. Again, they're going to be using the hyaluronic every 20 to 30 minutes for the next 2 to 4 hours. That'll help bring down that inflammation and help to speed up healing. And so then we'll just leave that on her for the next 10 minutes. When I remove this, I'm going to massage more hyaluronic into her skin. I'll be giving her her hyaluronic to take home along with her post-care sheet. And I'll see her back in 4 weeks, and I'll make sure to schedule her before she leaves.